Welcome back to MediByte. Today, we're going to talk about aspergillosis, an infection caused by a fungus that is so incredibly common, you're probably breathing it in right now. So, how can something that's harmless to most of us become such a serious threat? Let's find out.
First, we're going to get to know the fungus itself. Then, we'll look at who is most vulnerable. Next, we'll break down the different forms of the disease, see how doctors diagnose and fight it, and wrap up with the single most important message you should remember.
All right, let's start with the absolute basics. What exactly is Aspergillus?
Now, just think about this for a second. What if something you come into contact with every single day, without even realizing it, was hiding a potential danger? That's really the core question when we talk about Aspergillus.
The disease it can cause is called aspergillosis. This is an infection that usually starts in the lungs, all from simply inhaling the spores of the Aspergillus fungus. And when I say it's everywhere, I mean it's unavoidable. It thrives in compost heaps, circulates through air vents, and floats around in regular household dust. Most of us breathe these spores in every single day with no effect at all. Our immune systems simply deal with them. But what happens when the immune system can't?
And that brings us to the crucial question. If we're all exposed to it, who actually gets sick? The key isn't the fungus, it's the strength of our immune system.
Aspergillosis is known as an opportunistic infection. Think of this fungus like a burglar who only checks for unlocked doors. It's always around, but it can only get in and cause trouble when the body's defenses, the immune system, are down.
The risk factors are pretty specific. They include conditions like cancer and advanced HIV, or treatments like chemotherapy and the anti-rejection drugs used after an organ transplant. The common thread here is anything that significantly weakens the body's natural defense system. These are the unlocked doors that give the fungus its opening.
So once the fungus gets in, what does the infection actually look like? Well, it turns out this isn't a one-size-fits-all disease. It can present in a bunch of different ways, depending on where it sets up shop in the body.
This chart really breaks down the different forms. In chronic pulmonary aspergillosis, a fungal ball called an aspergilloma can form in the lungs. It can also cause sinus infections with congestion and pain. In people with asthma, it can even trigger an allergic reaction. But the most dangerous form is invasive aspergillosis. This is a true medical emergency, where the infection escapes the lungs and spreads through the bloodstream, threatening critical organs like the brain and heart.
So, with so many varied symptoms, how do doctors pinpoint the cause and decide on a treatment? Let's take a look at the diagnostic process.
Diagnosis is like a multi-step investigation. It starts with the patient's symptoms, but confirmation requires more. Doctors might take a sample directly from the lungs or sinuses. In the lab, they'll try to grow the fungus from that sample. They also use tools like CT scans to look for fungal balls in the lungs, and even advanced genetic tests like PCR to detect the fungus's DNA.
Treatment really depends on the type of infection. For the dangerous invasive form, powerful antifungal drugs, like you see on the left, are the first line of defense. But for those fungal balls, it's a different challenge. Medication can stop them from growing, but often can't get rid of them. As the right side shows, if that ball is causing serious issues like bleeding, the only option might be high-risk surgery to remove it.
We've covered what this fungus is, who gets affected, and how it's treated. So, what's the most important idea to take away from all of this?
Here's the bottom line. For most of us, the fungus itself isn't the enemy. It's just a normal part of the world around us. The real story of aspergillosis is about vulnerability. It's a disease that acts as a powerful reminder of how important our immune system is, quietly protecting us every single day.
And that's our look at aspergillosis. If you found this explainer helpful and want to understand more health topics in a clear, direct way, please hit like, share, and subscribe to the MediByte channel. Thanks for watching.